Now let's see the branches from the third part of the maxillary artery. And this third part of the maxillary artery, as we all know, that this branch, it passes between the two head of the lateral pterygoid muscle and going to enter into this pterygopalatine fossa through this fissure. That fissure, it is called as the pterygomaxillary fissure. And this part of the maxillary artery, that is the pterygopalatine part, which gives off 6 branches, and the first 2 branches from this third part, it will be given off before entering this artery into this pterygopalatine fossa. The first branch, that is the posterior superior alveolar artery, and this posterior superior alveolar artery, it enters into this maxilla by this minute foraminas on the back of the maxilla to provide the arterial supply to these molars as well as the premolars, along with the mucosa of the maxillary air sinus. The second branch, which is going to given off from this third part of this maxillary artery before entering into this pterygopalatine fossa, that branch, it is the infraorbital artery. This infraorbital artery, it enters into the orbit through this inferior orbital fissure, and from the inferior orbital fissure, this artery runs within this infraorbital groove, and then it enters the infraorbital canal and coming out from this infraorbital foramina. Before coming out from this infraorbital foramina, this infraorbital artery gives off 2 types of branches. One is the orbital branches, and these orbital branches, they are going to supply the muscles of the eyeball nearer the floor of the orbit. The second type of the branches, that is the anterior superior alveolar artery. This anterior superior alveolar artery, it runs within this maxillary bone and going to supply the mucosa of the incisor as well as the canine tooth, along with the adjoining gums and the mucosa of the maxillary sinus. After coming out from this infraorbital foramina, this infraorbital artery gives off 3 types of branches. These are going to supply the medial angle of the eye along with the lacrimal sac, and artery to the lateral part of the nose, and artery to the upper lip. Now the third branch from this third part of the maxillary artery, which is going to given off within this pterygopalatine fossa, and this pterygopalatine fossa, it gives off the pharyngeal branch, and this pharyngeal branch, it is going to coming out from this palatovaginal canal, and through this palatovaginal canal, it is going to supply the mucosa of the pharynx as well as the auditory tube, which is present within the lateral wall of the pharynx, and the mucosa of the sphenoidal air sinuses, which is within the body of the sphenoid. The fourth branch from this third part of the maxillary artery, that is the artery to the pterygoid canal. This artery to the pterygoid canal, it is going to pass backward and coming out from this canal, that is the pterygoid canal. This pterygoid canal, it is communicates with the pterygopalatine fossa anteriorly, and from this pterygopalatine fossa, the artery to the pterygoid canal runs along with this pterygoid canal and coming out posteriorly and going to supply the mucosa of the pharynx, the auditory tube, which is present here in the sulcus tubi. This is the part of the sulcus tubi, and here we can appreciate the full sulcus tubi. Here the petrous part is removed, so this is the only anterior half of the sulcus tubi. So this artery going to supply the mucosa of the pharynx along with this sulcus tubi, so auditory tube, and the branches to the pharynx. The fifth branch of this third part of the maxillary artery, it is the greater palatine artery, and this greater palatine artery, which is going to pass downward and reach up to the roof of the mouth through this greater palatine foramina. After coming out from this greater palatine foramina, this greater palatine artery will pass anterolaterally to reach up to the incisive canal and enter into the incisive canal to reach up to the nasal cavity, and which is going to anastomose with one of the branch of the spinopalatine artery, that is the long spinopalatine artery. Before coming out from this greater palatine foramina, this greater palatine artery provides so many numerous branches. These are the lesser palatine arteries which are going to coming out from this minute lesser palatine foraminas just near the greater palatine foramina, and which is going to supply the soft palate as well as the palatine tonsil. The last branch of this third part of this maxillary artery, which is the spinopalatine artery, this spinopalatine artery, it is going to enter into this nasal cavity through the pterygopalatine fossa, and here we can see one foramen which is leads to this nasal cavity. We can see the probe moving here. So through this, the branch of the third part of the maxillary artery, that is spinopalatine artery, enters into the nasal cavity, and into the lateral wall of the nasal cavity this artery divides into two branches. One branch that runs within the lateral wall of this nasal cavity posteriorly, so that is the posterior lateral nasal branches, and one branch it is going to supply this nasal septum posteriorly, so this branch, it is the posterior septal nasal branches. These posterior lateral nasal branches, they are going to ramify over the mucosa of the lateral wall of the nose and going to supply the concha as well as the ethmoidal air sinuses, while these posterior nasal septal branches, which are going to run forward and downward and reach up to the anterior part of this nasal septum somewhere here to anastomose with the branch of the greater palatine artery. And this long branch of the posterior nasal septal artery, it is the long spinopalatine artery. So this is all about the orientation of the maxillary artery and its branches.
Now, after having the completion of the orientation of the maxillary artery on dry skull, let's see the branches over this figure. Here in this figure, this is the main external carotid artery. This external carotid artery is bifurcated into this superficial temporal artery and this maxillary artery. Here in this maxillary artery, this is the demarcation between the first and second part of the maxillary artery, and this is the demarcation of the second and third part of the maxillary artery. So this is the first part of the maxillary artery. There are 5 branches from the first part of the maxillary artery, and this one is the deep auricular artery. Just next to it, this artery, it is the anterior tympanic artery, and 2 branches, they passes upward and going to reach up to the middle cranial fossa, and these 2 arteries are the middle meningeal and accessory meningeal artery. And the last branch of the first part of the maxillary artery, it passes downward, and this artery, it is the inferior alveolar artery, which provide one mylohyoid branch. Now this part of the artery, which is in front of the lower head of the lateral pterygoid muscle, and that is the pterygoid part, and from the second part of the maxillary artery, the muscular branches are going to arise, and this muscular branches, this is the deep temporal artery, and this is also the deep temporal artery. So these 2 are the deep temporal arteries. Here this artery, it is the artery to the pterygoid muscle, and this is also the artery to the pterygoid muscle, and these 2 are the pterygoid arteries. This one, it is the artery to the masseter muscle, and this artery is the masseteric artery, and this one, it is the artery to the buccinator muscle, and the name of this artery is the buccal artery. Now let's see the branches from the third part, and this part, it is called as pterygopalatine part, which gives of 6 branches. This part of the maxillary artery provides 2 branches before entering into the pterygopalatine fossa, and the first one is this one, and this is the posterior superior alveolar artery. The second branch which is given off from this third part of the maxillary artery before entering into pterygopalatine fossa, and this branch, it is the infraorbital artery. Here the one of the branch of the third part of the maxillary artery, it passes downward, and this branch, it is the craterpalatine artery. The two branches, they are going to passes backward from the third part of the maxillary artery, and these two are the pharyngeal artery as well as the artery to the pterygoid canal. And one branch, it passes to the medial side and enter into the nose, and this branch, it is called as spinopalatine artery. So for the quick revision, you can pause this slide and revise the branches of the maxillary artery. So this is all about the maxillary artery. Hope you understand well. Thanks for watching.